Coming up next on Words and Numbers, snow.
The Dutch tax code goes crazy.
The dumbest sheriff in American history.
And all sorts of things you didn't know about health insurance.
All this and more coming up next on Words and Numbers, a Civil original production. Check us out at civil.com. That's CIVL.com.
Hi, I'm James.
And I'm Anthony.
And this is Words and Numbers.
Ant, it's new and exciting in your world this week.
Oh, I've got a doozy this time. This comes from listener Thomas Lockwood. He posted this on the Words and Numbers Backstage Facebook group, which, we push the Facebook group from time to time. It's worth mentioning again. This is a group of roughly 1,600 people. They've been with us for 8-9 years now on Facebook, and they just discuss all kinds of things. Often it's something we've talked about on the episodes, but not always. Things to do with economics, government, bad jokes, these sorts of things. Generally, it's a very civil discussion. People disagree in the best way I've seen anywhere.
Yeah, you're overselling it because
it's not perfect. It's not perfect.
There's a lot of nonsense going on over there, and all the people on the left say those people on the right are the devil, and the people on the right say, God, those people on the left, they're all deranged, and they yell at each other, and it just drives me nuts. But they all tell me that the signal-to-noise ratio is better on Words and Numbers Backstage than it is anywhere else. Now, we're always working to try and get people to play nice, but, that's hard. Nonetheless, they play nicer.
They do, and I have to say, while it's been frustrating, one of the things that I've come to really like is the fact that we don't resort to kicking people out.
I'm about to kick somebody out, but that's right. That's right.
Well, it does happen from time to time, but much more often than not, the people that are there provide gentle guidance and example to those who bring their, how should I say, their usual experience with social media to us.
Yeah, that's right.
But let me get to this article. This is
one last thing. The reason this even exists is because we used to get so much email on every episode that we couldn't hope to answer it. So we just said, hey, maybe we should have a place where everybody can come and hang out. And that's what it's become. I try to get there a couple of times a day, and I like it. I like meeting the people who hang out listening to our podcast. And it's a weird thing when you're a podcaster because people out there think they know you. And I'm sure this is true of everybody with a forward-facing job, right? People in Hollywood have been saying this for years. But there are people out there who are convinced they know me. And you know what, Ant? They kind of do. But I don't know them at all. And I get to meet them on Backstage.
I have to give a shout out to one of our listeners, Wayne. I'm not going to give his last name, but I ran into Wayne in Denver, Colorado this past week. And I was giving a talk for, my current employer sends me around the country. I give talks on the economy, this sort of thing. And the room was maybe 150 people. And I do my thing for whatever I was up there for, an hour. And I step off the stage, and a guy in the front row sticks his hand out and says, "That was great. Where's James?" He's a Words and Numbers listener.
Where's James indeed? That's right.
So Wayne, thanks for listening.
And Wayne, thanks for asking the obvious question. But you had something to say about something.
Oh, I'm sorry. Yes. So Thomas Lockwood posts this. This is a recent article about the Netherlands, and what's happened here is the Dutch have approved a 36% tax on unrealized gains. Now, there's some footnotes here, but basically it boils down to the article identifies crypto, stock, and bonds.
And that's going to work out real well.
This is what people have been pushing for in this country. I guess it's not exactly a wealth tax, but it's in the neighborhood of.
This is a wealth tax.
And the deal here is you buy something, let's use stock as an example. You buy some stock and let's say you buy it for $100. You invest $100 in this stock and the stock price rises. It's now worth $150. Now you haven't sold it. You're still holding on to it. So you don't have $150. This is just gains on paper. But the Dutch are now going to tax that $50 gain to the tune of 36%. So at the end of the year, you're going to owe whatever that is on the tax on that, even if you have not sold this stock.
Which means you're going to sell the stock.
Yeah, I'll come to that in a second. Now, to give the Dutch their due here, they have made it symmetric. So if there's a loss, that comes off your taxes. And according to this, the loss is, it doesn't matter how far out. So if I buy the stock today and finally I sell it 50 years from now, whatever gains and losses over the course of those 50 years, the gains would be taxed, the losses would be the reverse of the tax. But this is what's going on. Now, as with American politicians, the Dutch apparently have developed this habit of naming laws using the exact opposite words of what the laws really do. This is called the Actual Return Act, when in fact it should be the Unrealized Return Act.
That's right. The Potential Return Act. And it's even worse than it sounds, Ant, because let's just say I did a smart thing once upon a time. I didn't. I never do smart things ever. We all know this, right? I make one terrible life choice after another. But let's say that I bought one Bitcoin and Bitcoin for 5 cents or whatever. And it promptly went up. Well, over some years, it went up to $125,000.
Yes.
And the government is going to have an arbitrary date upon which it will value my things. Maybe
you're going to get a $40,000 tax bill.
Well, maybe they arbitrarily pick the highest time. And then my single Bitcoin falls to $60,000, as it kind of did. And then I owe 40, a little more than 40, actually, I think. But let's just say 40, to satisfy some politicians' craven lust for stealing things. And it's going to be like that on asset class after asset class, unless you can buy something that the government can't keep track of.
Yeah, I'm glad you brought up this example, because as I think about this, I realize this law is in effect shutting lower income people, maybe even middle income people, out of better investments. Because what do we know? We know on average, the greater the return on an investment, the greater the risk, the greater the volatility of the thing. Well, here's the thing. If you're going to invest in something like crypto that has tremendously high volatility, and you then run the problem of you could get a $40,000 tax bill one year,
which I can't pay.
You're not going to, the only people who are going to be investing in those high risk, high return assets are people who have a bunch of cash sitting around that they can afford to pay the tax man. Regular middle class or lower class people that want to get in on crypto, forget it. You can't afford it.
And it's probably going to be the same with stocks. They're going to get hit.
Stocks
if you have a portfolio, you're going to get hit so hard that you're going to have to sell off probably 40% of your portfolio to cover a 30% tax or 36% tax. And
I want to point out
what politicians here keep telling us we should do.
Right. Yeah. Well,
and this is a question. Hey, I got a question for you, Ant. How many times can you do it? You could do the tax once. Could you have the tax twice over 2 years? Maybe.
Oh, that's a good question.
Could you do it? Could you do it 3 times? No, you cannot do it 3 times.
Yeah, I'm assuming. I'm not sure if this answers your question. I'm assuming from what I've read here, the way they've described it, that this is a once a year thing. So it's like when you file your taxes, you say, okay, as of right now, what are things worth? You owe the difference between that and what you bought them for.
If they're going to do this bullshit every year, I guarantee.
Oh, yeah.
I
Yeah.
guarantee you, economies will crash.
Well, in
That's
this sense,
a
I
when
say
question now.
I say
That's not an
thank
if
God
question.
for
That's
the
a when question.
thank God for the Dutch, because they're going to be a beautiful example. After a couple of years, when this comes back around in the U.S., we'll be able to point to the Dutch and say, look at what happened over
Yep,
there.
I want to
Only the very rich can afford to invest in things because you've got to have the cash buffer to pay the tax man. But nonetheless, there's one more thing that annoys me here. And that is, in this article, they quote, and I believe, they don't say who it is, but they put it in quotes, and at the time they're talking about the Dutch Treasury. So it's possible they're quoting them. But nonetheless, this is in the article. They say, the lack of this, apparently the government's politicians have been pushing for this law for some time, but the lack of the law up till this point has been costing the Dutch Treasury 2.3 billion euros per year.
Boy, that
No, no, you can't lose what you don't own. To say that the lack of the law is costing you 2.3 billion reveals the fact that you, politicians, believe that all of that income out there ultimately actually belongs to the government, and we're just going to allow the people to keep a little bit for their personal use. It's not costing you anything.
That's right. I want to see this in 3 years' time, because if they keep this up for 3 years, that economy is going to look a lot like Vietnam.
Well, and this is the problem with all of Europe. And for all the problems we have in the U.S., our economic growth. Now, Europe's economy, the European Union economy is actually larger than the U.S. economy. But for all of our problems, our growth is way bigger than Europe's growth is or ever could be, and it's because of nonsense like this.
Nonsense like this, that's right. Boy, this
So,
one's
Thomas,
really making
thank
me
you for
angry.
the article.
Yeah, and honestly, Aunt, truth be told, this was a candidate for the foolishness of the week, but I found something so much dumber.
More foolish.
Oh, so much dumber that this just kind of lost out. So I'm glad that you brought it up. In the news right this second is a very strange occurrence. There is more snow in Florida, in certain parts of Florida, than in Salt Lake City, Utah.
Yeah, I would believe that. I told you I was just in Denver. It was 10 degrees here in Washington, D.C. area. I go to Denver, it's 55. They had a sign outside the hotel saying, please close the door because of the inclement weather. I went up to the desk. I said, what do you mean inclement weather? This is great.
Every now and then somebody will try to Zoom call me and I'll be out on my back porch smoking a cigar. And they just start swearing at me because it's, 8 degrees back on the East Coast. And I'm outside in a short sleeve T-shirt. But, I mean, imagine Florida having more snow than Salt Lake City. Salt Lake City is a ski destination.
Yeah.
Holy crap. Weird goings-on about the weather this time of year. Everywhere you look, weird stuff. I have no point. I just thought it fascinating. So on to something I do have a point about. And I tweeted this out last week. The single best thing for me about doing this podcast is that I get the absolute joy of going out and finding somebody to make fun of every single week in the foolishness of the week. But when something becomes as enjoyable as this, everybody wants to jump on board. And I get emails, I get texts, I get Facebook messages, and I mean daily, saying, I bet this is the foolishness of the week. And I usually look and say, oh, God, not even close. You're not even in the zip code. But when our good friend Wes Westmoreland sends something over, you can bet your bottom dollar that it's going to end up being not only the foolishness of the week, but something I literally can't believe is true. And
Wes has a good nose for foolishness.
He really does have an eye for it. And there was a hearing that involved a sheriff who is noted as an anti-ICE sheriff, so you can figure out what the hearing, was likely about. It was in North Carolina, where our friend Wes lives, and it was in Mecklenburg County. And the sheriff of Mecklenburg County, when asked, "What branch of government do you operate under?" Now, I think almost anybody who is involved with words and numbers to any degree knows the answer to that question pretty quickly. I think anybody who's studied for an immigration test knows the answer to that question pretty quickly.
Or at the least could name what are the branches of government.
Yeah, but Sheriff Gary McFadden kind of let himself out as a bit of a moron, because when asked, what branch do you operate under, his answer was Mecklenburg County, not realizing that Mecklenburg County is not a branch. That's the county where that little girl from the Ukraine was killed, you might recall. So this sheriff has probably had some media training. I'm just guessing, right? People have probably said, these are the sorts of things you should be aware of given your job and the nonsense that's happening. The representative, Mr. Chesser, repeated, "What branch of government do you operate under, Sheriff?" And the sheriff had an epiphany and said, "Oh, the Constitution of the United States." To which Chesser responded, "That's what establishes the branches of government. I'm asking what branch you fall under." McFadden answers, once again, reaching back into a well he had already dug into, Mecklenburg County. Chesser remarked, "This is not where I anticipated getting stuck. Are you aware of how many branches of government there are?" The sheriff shot back, "No." After a long pause, I bet it was real long, Chesser continues, "For the sake of debate, let's say there are 3 branches of government: legislative, executive, judicial. Of those 3, which do you fall under?" The sheriff answered, "I believe I fall under the last one, judicial." This might be the dumbest sheriff in the history of sheriffs. All law enforcement is executive by nature. How does a sheriff not know that? For the love of God, you're an economist. Even you know that.
Well, yeah, I mean, they teach you this in what, 9th grade, 10th grade?
I would 5th. I mean, it's just ridiculous. And these are the people, or this is one, let's be fair. This is one of the people who is charged with enforcing the law. A law
Right.
that he knows absolutely nothing about at the most basic level. Way to go, Mecklenburg, North Carolina.
I'm Anthony Davies, co-host of Words and Numbers. James Harrigan and I are proud to be on Civil's network because we believe in their unifying principle of human respect, which is the idea that our well-being as humans is diminished when we employ coercion, and that conversely, our happiness and prosperity are maximized when we cooperate. If you agree, please join us at civil.com. That's CIVL.com. This week, David Greene joins us. David is a former healthcare executive and independent consultant who spent 3 decades inside the health insurance system. He has held senior roles at national insurers and later advised covered California and state leaders during the rollout of the Affordable Care Act. Dave joins Words and Numbers to discuss how rational responses to incentives shaped today's healthcare system and patient experience. David, welcome back to Words and Numbers. And I say welcome back even though you've actually never been on it, because you have the honor of being involved in the only episode we have ever recorded that never got published because of all sorts of technical errors. In fact, it's the only time in our 8 years of existence we didn't come out with an episode. It's all because of you.
I got to tell you, man, it was easily. Now, I don't want to say it was the worst episode because we've put out some stinkers on our own, but it technically speaking, it was a train wreck.
James' technology wasn't working, mine wasn't working, yours wasn't working. And then, like 75% way through the episode, I kept hearing this womp, 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 womp coming
That
from
was
David.
my favorite part. I actually knew what that was before he even told us, because as loyal viewers, not listeners, but viewers of Words and Numbers will know, my dog will routinely walk in here, hop up, put her arms on my shoulder and lick my head as I talk into this microphone. And it sounded for all the world like David had a dog and it was trying to get its mouth around a toy.
Which was exactly right. Looking back on that attempt that we had, it feels very on brand for healthcare. Honestly, when we looked at it, we were confused. We didn't know who was accountable, and that's what a lot of patients feel in today's world. And so that's how I chose to look at it when I did my own post look. And but all that said, very happy to be back. Thank you guys. And where would you like to start?
Very happy that you were willing to come back, given
Right, yes.
the mess
You're very brave.
that we foisted upon you. You are very brave and very kind. And I will say, you're running the risk of really having an unpleasant conversation, because I have spent probably 25% of my waking hours in the last 2 weeks trying to get various healthcare issues sorted out, and I have made exactly no headway. Yeah, so I'm good and cheesed about this topic before we even start.
Now, before we jump in, we've had people on at least once before who are healthcare professionals who talk about the healthcare side of it. We specifically want to talk about the insurance side of it. And I think a lot of people, they talk about problems with healthcare and they conflate those two. So specifically, we'll talk about healthcare insurance.
Well, good, because that's what I spent 30 years doing. And I think that there's a lot to the business end of healthcare in today's world that affects people in ways that they don't see. And so I'm more than willing to do my best, and let's talk.
Dave, can I ask a personal question as we get started here?
Sure.
What did you find that your job was incredibly frustrating, the same way that people on the other side of it do?
Yes. And I think that one thing you notice as you delve in deeper is that even when I was, and this is going to sound a little bad, but even when I was consulting with a lot of state and government employees on the side of healthcare, they are inside a system where the incentives, where the system forces them to not do a lot of things that they would like to do that are good. And so, yes, I definitely felt it. And that's one of the reasons why I really wanted to try to do further breakdowns of what is wrong with healthcare. And that's why I spent a lot of time working on various projects that ultimately had us learn about each other and talk.
Maybe I can get us started this way, because like I said, I've been very frustrated the last couple of weeks, and when I get frustrated, I look at Twitter. And today I tweeted, or whatever we call tweets now, that it has become my opinion that the American healthcare system, in quotes, whatever we mean even by American healthcare system, is designed to keep people, or to make people so frustrated in getting their own care that they give up. It's so Byzantine on purpose.
I would agree with what you said, except for the on purpose part. I would say that there's an evolution that has taken place, all going back to what you guys have covered in the past, which talks about the changeover in the World War II era, where the healthcare shifted to be employer-based because of the Stabilization Act of 42. And when that pushed benefits onto the employer side, that's the core moment that launched a lot of the misalignments and a lot of the moral hazard that we're experiencing up through today. And then other decisions have been made along the way that have compounded that. And so I feel your pain. I know it. I've been going through it with a family member personally recently. And I think there are ways that we can look back at the core incentive drivers of why things are what they are. And that's what I've really been working on recently, to create a framework on how to assess policy and new legislation and other changes that might be coming up, to try to understand what the actual consequences will be when those policies hit the market.
So tell me this, because I've come to think of health insurance much like I think about taxes, that it's a lottery. I go into the hospital and I have no idea at the end of the day whether I'm going to get a $1,000 bill or a $500 bill or no bill at all. In fact, in one case, it was when our child number 3 was born.
Mm-hmm.
We were in West Virginia at the time. You go to the hospital. It was an uneventful birth. Everything was normal, all of this stuff. And I get a bill subsequently from the hospital for whatever it was. I have no idea. They send me this itemized thing. I don't even know what I'm looking at. I just pay it. Time goes by. I get another bill from the hospital for a different amount.
Mm-hmm.
Again, look, I've got a PhD in economics, and I couldn't figure out what they were sending me. I just pay it. Fine. So there we are. A couple months go by, no more bills. I figured, okay, whatever it was, I've paid it. And about 3 months after that, I got a check from the hospital for some strange amount, like $325.96. Okay, so I deposited that check. Those checks, for different amounts, all in a couple $100s, they kept coming like every few months for years. I have no idea what was going on.
First, you guys sound a lot like what I hear at, social gatherings once people find out what I do or did. But I would also say what you're touching on is based in price transparency from the get-go. Because each major player in the marketplace has a reason to keep prices hidden. They have incentive to do that. And some of the incentives are a little bit small, but none of the incentives are big enough for any of the players to want to change that, because there's no with them. There's no what's in it for them for doing so. And I think one of the things, I don't know what insurance you have, Ant, and that becomes a whole other level of discussion, what medical systems, etc. But one thing they all have in common is that they don't show prices, and it usually starts with the insurer. And there are very legitimate reasons from an incentive perspective why they don't want to show that. I could break that down a bit if you'd like.
Well, along those lines, I'd like to know, look, somebody somewhere knows what the price is.
Oh, yeah.
The doctors don't, the patient doesn't. Is there somebody in the hospital who can say, yeah, an x-ray costs this much?
Yes. But the reason why it's not said is, let's go to the insurance company to start with, because that's where you're getting all of your bills from. And the insurance companies at the beginning, they negotiate with each and every provider in the marketplace. And depending on the dynamics that are in place, the provider might be a better negotiator or the health plan might be a better negotiator. And so for all sorts of services, the same provider, it could be a hospital, a doctor's office, a clinic, they're all going to have different prices negotiated on the books. And what the insurer does is they now don't want to make that public because, and this is their incentive, because if they did make it public, what they would essentially be doing is allowing all the other providers to see what rates that they ended up negotiating. And that public showing would tell some of the providers, hey, I should be negotiating harder. And so while that's one of the two primary ways that insurers work to help mitigate costs in the marketplace, the other is by tiering networks. When you see there's a narrow network and a wider network in the marketplace, you're seeing networks determined almost exclusively by the negotiated pricing. Now, here's where that breaks down in healthcare versus other types of insurances like auto or whatever. And the way it does is that many marketplaces have a marquee or a very known provider that the public wants. For example, in California, Northern Cal, you would want the Stanford Medical Center to be available as in your network, so that because people love the reputation of them. In Southern Cal, you might have UCLA Med Center. In other places, you'll have other prominent medical systems. People want that. And so the decision on which network that you're going to be in is a timing issue, because that's made up front at the time when you purchase the actual coverage. So those are the ways in which a health insurance company benefits from hiding the cost, is they could use networks and they can use negotiating to help to try to keep prices down. But by and large, they don't have much power to do that because their negotiation position is often pretty weak with a lot of the providers in the marketplace. And what they have to do is focus on what they actually do best, and that is pooling risk and protecting people from catastrophic loss. The other thing that they have to do is maintain connection to all sorts of disparate payment systems and people who are submitting bills to them to be paid at a certain percentage based on the benefit plan that's been purchased. So all those factors involved say why insurance carrier wants to maintain their position in the marketplace based on their brand, their network size, the premiums that they could put in place. And that's how they stay relevant in the marketplace. That doesn't solve your multiple check issue, Ant, but what it does do is help explain the multiple connections that insurers have to keep in the marketplace and why they do benefit from that pricing remaining hidden. And you'll find there's reasons for every other player in the marketplace to keep it hidden too. I mean, hospitals from the perspective of wanting to hold back on those same various negotiated prices that they have with each of the insurers that they have to work with, as we just discussed, and how they cost share, how they use commercial coverage to help make up for losses that they might get on Medicaid patients, where the payment that they receive isn't always covering the cost that they have to put forth.
If I may, I'd like you, from your perspective, given everything you just said, to explain something that happened to me in the not too distant past. I needed an MRI, no great shakes. I went to there's a Banner Hospital here in town. No big deal. It doesn't have a particularly good reputation. People tend to hate it. But I walked in with my paperwork and I said, I have to get an MRI. Here's my insurance card. I'm insured by some flavor of Blue Cross, Blue Shield at the time. And the woman said, okay, your copay is $1,600.
Mm-hmm.
And I said, I'll be on my way now because, and then I said words I'm not allowed to say on Words and Numbers. And then I opened the phone book, metaphorically, and there's a place in town called Simon Med, which does walk-in imaging, and it cost me $200 to get an MRI.
Mm-hmm.
So how is my copay 8 times my actual cost?
It comes down to what was negotiated for your particular health plan. You are uncovering when you do that. And I just did it for a family member pertaining to a colonoscopy. They were quoted $8,000 for a colonoscopy at one facility. We hopped on the phone. We found one that was 45 minutes away for $3,000. And the point is that you have that kind of huge variation in pricing in the marketplace right now, because it all comes back to the incentives to keep prices hidden. And if things were to be transparent, let's go back to that world, James, because I'm not going to be able to answer the details of what you're asking. But
it just seems, asinine that my
It is.
copay is 8 times what the out-of-pocket complete payment is.
It is. And that's why transparency would really help people in the marketplace and really hurt others. You would find the people in the long term that would gain the most are the patients. In the short term right now, patients actually have incentive themselves to keep pricing transparent and not know it, because it helps making decisions about care easier for the now, and then the bills start coming months later until, in Ant's case, the checks start coming back to him months later. And so the employers are able to keep topics off the table, like, is what I spend on wages worth it? And meaning the employees would begin to ask the questions to say, do I want this benefit package, or would I rather have the difference in wages? But let's go back to say, if you had, if price transparency became known as a general rule, and business models matter, so there's going to be exceptions within the category, you would find hospitals have the most to lose. And that's who you said you went to first for pricing.
That's right.
And because that would really expose the price variation and threaten the cross subsidies that take place within the system. And you'll find that most of the time, who's bearing the brunt of the cross subsidy is the employer-sponsored coverage, because that's where you have the least rules that govern what pricing can be. In fact, the ACA, even though it was mostly driven to the individual marketplace, has come back and has been a driver of employer-sponsored coverage price increases.
Both of you relayed examples that were stunning to me, and they involve comparison shopping.
Mm-hmm.
People don't, at least in my experience, they comparison shop for all kinds of things, but never for healthcare. That, you're told to go to the hospital and get some tests, so off you go, and you go to the hospital you always go to. To what extent would prices come down if more people did what you two did?
Well, it has to go beyond what we did, but it starts with what we did, because we actually, I went back to who we were quoted $8,000 for and informed them of that. And they claimed that their jaw was on the floor about that price difference and how they were losing a customer. So yes, that has some effect, but society has been trained to not negotiate health prices because one, they've never known what the costs were. They don't see the prices up front. And then there's the other parameters that have to happen within pricing is you might get quoted a different price, but you have to make sure that you're comparing the same units of care, meaning, am I getting the radiologist reading included in the $3,000 versus the $8,000? What's all included in the price? And then obviously wanting to know what the a margin of cost thinking issue, which is to know what my all alternatives might be. But so that's why showing the prices would disrupt the marketplace tremendously. And some would survive well and some wouldn't. But right now, I would agree that it's incredibly frustrating because you could really look at some hospitals out there being very good pricing strategies with a building attached.
That's a really good way of looking at it. I've never actually thought about it in those terms, but it's sad and very, very insightful.
Civil is on a mission to host ideas that will lead humanity to an abundant future. Civil is a streaming platform with apps on TV and mobile. Watch shows, films, and debates and be part of an emerging community of people who believe we can innovate beyond our legacy systems built on coercion and zero-sum politics. Join Civil and let's build a new era of prosperity together. Learn more at civil.com. That's CIVL.com.
I actually worked for an attorney when I was in graduate school, and I learned a very strange thing about healthcare and price when I did that. One day I was sitting at my desk and he dropped a bunch of files on my desk and he said, "Go renegotiate all of these medical bills." And I said, "You can do that?" He said, "Yeah, just call those numbers, tell them this guy is never, ever going to pay that, and ask them what they'll accept." And I did that, and they almost always came back within somewhere within 10 and 30%. Just like that.
Not 10 or 30% off, but 10 or 30% of the original.
Of the total. And I got so used to it that I changed my approach, and I would call and say, "Can you do 10% on this?" No one ever said no.
They have a lot of patients that come through and never get anything. So you are offering something. So they're going to say yes to that. And just ultimately a volume-based business. So they're going to take what they can get from each iteration of patient care that they can. And yeah, there is, again, I think it comes back to how we've been trained as a society so far. And I think that because of that, we have had each individual component of the market find a place to work in opacity of price. And that has led to the experiences that you, James, have had and that I've learned over the years. You should go back and thank that attorney.
Yeah, that's right. Let's go to the obvious question. What are some common sense things that can be done? Because this is a mess. Everybody knows this is a mess.
And that's why we have let's talk about what the ACA did. All the ACA did, the Affordable Care Act is what I'm referring to. All that did was create a whole lot of extra money going into the broken system, because it took the premiums, put those premiums on the taxpayer for those who couldn't normally afford insurance. And that insurance is just more money flowing into a system that has misaligned incentives. Most all of it is driven by the benefit design plans that are designed to make the upfront cost to the patient extremely low. And that extremely low, which sometimes borders on free, is allowing people to just say, all right, give me that next test, give me that next whatever. And those are what allow for prices to go up because patients don't see the marginal cost of the decisions that are being made. So that's one thing around pricing that I would say has to happen. And it's just, I was thinking about it because we had time between our first try and this one, and about a lot of what you guys speak about. And to me, it's no different than what happened in education. You had government secure loans. So all of a sudden they were securing money flowing into the education system, and the education system bloated. Well, that's the same thing that's happened on the misaligned incentives that happened with the huge amount of money that's being poured into the system that was already broken in healthcare. That was the analogy that I drew. You guys would know better how well it holds or not.
It's interesting you say that because I've seen side-to-side graphs over time of the growth in the number of people employed in healthcare who don't deliver healthcare.
Mm-hmm.
It goes remarkably up. You can look at the same kind of graph for higher education. People employed in higher education who aren't involved in education. And that goes up the same way. And in both cases, it's the institutions hiring people to make sure that they are compliant with and can handle the paperwork that's involved with all of the tax money that's coming in to fund this thing.
100%. You find that exact same thing in healthcare with the regulations that are passed, and it takes a lot of really smart, educated people to be able to navigate that, and those costs have to be passed on.
You said
And
something.
which of the two costs that have skyrocketed over the past 30 years? Healthcare.
I personally believe that the core of both of those is the massive amount of funding that has been essentially guaranteed through the policy changes that took effect.
Yeah.
You said something in our first attempt at this episode that I want to make sure we come back to because it was news to me. You said that the profit margin that health insurance companies face is very small.
Yeah. It's approximately 2 to 4% across the board. You'll find that other pockets of the industry, such as medical devices, and they will have a higher margin. They will be maybe 15% plus or minus range, sometimes even higher. That could be low depending on what the device is. And you'll find pharma can have higher margins too on certain things. But by and large, insurance companies' margins are tight. And I think that's consistent with what we spoke about earlier on the call, if we want to sit back and give it another look. And that is that health insurance companies across the board have very little power in terms of being able to hold costs down. They are largely price takers. They can do some negotiations at the margins. They can do some things like the network tiering that we discussed to help hold down prices. But otherwise, they're price takers. They are working on doing what they do best, which is managing the risk to help keep the price down. And otherwise, they're a marketing machine for sales. And you see that close to commodity type operation reflected in the margins which they make. Now, there's huge amount of money flowing through these insurance carriers, especially the larger ones. So their margins look huge from a dollar perspective, but their margins are actually pretty slim.
So where is the money going? You mentioned pharmaceuticals, for example. That can't be the lion's share of it. Who's ending up? We're paying a lot of money. Where's it going?
Well, it is spread out, but I would say it's going to the more institutional the player in the marketplace, the more money that's going to them. So I would say in terms of volume of dollars, you're looking at the hospital systems. Um, you're looking at health insurance companies definitely take some. I mean, a lot of this is the cost of care. I don't want to sit back here and say that there's certain people making unbelievable margins across the board. That just doesn't exist. I mean, you might be able to argue if you went deeper into the books how much is margin versus how much is admin cost, etc., and other types of overhead costs. But you're finding the vast preponderance, you could find 90% or more of the money that goes into an insurance company is pumped right back out into the marketplace to take care of what they're being billed as cost of care.
So
Yeah, and
if
I
I'm
think
hearing
that's
you
worth
correctly,
underlying. James and I have talked about that our level of health care is tremendous now. I'll give you an anecdote. A friend of mine I ran into today, I said, hi, I saw him last week. I said, hey, how was your week? He said, oh, it was all right. I had a heart valve replacement. He went in, they do the heart valve, and it's an outpatient. He's in there for a couple of hours, and then he goes home, and that's it. When I was younger, that was a multi-week process, and they tear your chest open and the whole business. And that level of science fiction doesn't come cheap.
Not at all. And I think you're absolutely right to be amazed at that, because I am.
I'm amazed
And
at that.
I think one of the questions that you often ask, Ant, is to say, hey, would you rather have 1950s healthcare at 1950s prices or today's healthcare at today's prices? One of the things I do in the framework document that I recently finished is I ask the question to say, what kind of healthcare do you want in 2100? And that takes the thinking of your question forward to say, what are we going to do to manage both cost and quality and innovation?
I heard every word you said, and I think let me kind of reframe it so people who don't think about healthcare very much can think about it in another way. If everything you said is correct, and I have no reason to think it's not, I am extraordinarily unlikely to find any company in this space with the margins of, say, Apple.
True.
Not going to happen.
I would
Not
say
gonna
you
happen,
might
right?
find a few, and that would be mostly in the medical device realm.
Right.
And it would be, I would say, relatively short-lived, depending on what kind of products that they have in their pipeline. But I would say overall, I would say your question or your result of your thinking is on target.
And I'm certainly never going to find it in the insurance world, in the medical insurance world.
No, you won't. And again, I think it's because when you look at it closer, you begin to see how close, and trust me, the people in the insurance world that I work with don't like me saying this, but they're at a commodity level or very close to it in how they operate. And that's why their margins are not very strong.
I think I like the way you put that, right? At a commodity level. I think that's a good way for people to get their fingers into it. But there's a broader question here. Why do they do such a fabulously poor job of public relations? Because we're at a point now where Luigi Mangione can walk up behind a CEO of a medical insurance company, kill him, and become a hero.
And get praised. I know. In a industry where you otherwise never see a price, the only place you see it is from the insurance company. And due to the nature of the way billing works and all the cycles that have to be gone through to understand what the price should be, people want to believe, and they're not necessarily wrong as long as they're defining it correctly, that healthcare is something that they should get because nothing is more valuable than health. And when now they're being asked to pay certain charges for it that are extremely high, they want to find a quote unquote villain. And the best villain to find is the one that's actually handing you the bill, whether it's their fault, for lack of a better word, or not. They are the ones who are the visible entity that is the most easiest target. And you have a lot of political messaging that helps to back that up.
And I'll just say the bleeding obvious at this point. The actual villain here is the federal government. That's how it started. That's what sustains it. That's where the political messaging is coming from. There's your villain.
And you wouldn't know it because what do you hear from the federal government? Elect me and I'll fix this problem.
Oh, I'll make it free.
Yeah, and as you guys both know, there's some significant issues with that when reality chooses to step into the room. And so, a lot of that falls under the same type of framework that we're applying to what I call a hybrid system. What we have right now is a cross between a free market system and a centralized system. And you really don't get the best parts of either when that happens, because you really begin to lose a point of accountability is the net of that. And so when you look at what a purely market-driven marketplace would look like, you have to have certain parameters in place. And if you choose to have a centralized system, you have a lot more things that you have to overcome to make it real. And you're stepping deeper into that political motivations bucket that you just brought up, James.
Tell me this, David. My understanding is that there's all this bucket of topics that we've talked about with health insurance. But then my understanding is Medicare is an entirely different thing, to the extent that when you go somewhere and you seek medical care, the question is it private insurance or is it Medicare? And different things happen. So my question to you is are we in a space where private health insurance is subsidizing Medicare, or is it the other way, or is that just not even a thing?
Oh, the former by far.
The private subsidizing Medicare.
Yes, and that's how you see things like Medicare is one of the huge reasons why hospitals cross price, because they need to make up some of the dollars, especially when they might have parts of their system, or they might just be a hospital in a rural area where they can't support the volume necessary. So you will definitely find it fall into the private sector. One of the things, let me get a little bit wonky for a second here and talk about how in the Affordable Care Act, there are rules in the Affordable Care Act that basically what they do is they have you look at how the premium costs are limited for what can be charged for the individual coverage. And so you find that the 90% of the people who have coverage through the ACA, they're paid for by the taxpayer. So 90% of the premiums there. And because the premiums must stay reasonable, and I put that in quotes because it needs to stay at that level, the carriers are very reluctant to want to put a lot of pricing pressure there, because it's being paid for by the taxpayers. So if costs start to run away on the individual side of the ACA, the insurance companies, who are already evil, are going to be the ones who are going to take the brunt of that. So what happens is you also have other factors that are built into the Affordable Care Act, such as you have what are called metal tier levels. And those metal tier levels are bronze, silver, gold, and platinum. And each one of those corresponds to what's called an actuarial value. And that value represents what that medical care should cost on average, or should be covered on average. My whole point being is that there's very tight parameters around what those values can be. And thus, while it doesn't define pricing, it gives a good indication of what kind of pricing window you have for each of those metal levels. The bigger point here being is that on the group insurance side, you don't have those restrictions. So you could have any value of care built into the benefit design, and the insurance company is free to price it with less oversight, for lack of a better phrase, because the employers can't back out. If they say no to every proposal that's dropped on their desk, they're going to lose their employees because they're not going to offer benefits anymore. And so they have a captive audience there where pressures to the way that it's become to be phrased, and things that I've worked on is I call them essentially the shock absorber in the marketplace. And that's how you find definitely to, and I know I'm driving your point home further, Ant, but it's definitely the large group health insurance sector that's sucking up a lot of the pain.
Well, all right, David, thank you. I mean, this has all been very disconcerting, of course. So thank you doesn't seem to be the right words to use, but thanks for sharing your time with us the way you have. You've been very generous with your time and your knowledge. And I just want to know, is there anything out there you're working on that you might like to have people know about?
Yeah, recently retired. And so one of the things that I've really taken on as a passion effort is launching a free educational project for community groups and students, and even just the curious adults out there. And it's called unravelingtwists.com. And it's working on explaining outcomes that surprise us. And it's very much aimed at looking at the incentives that are created by policies and how the outcomes don't necessarily match the intent. And there's all sorts of subjects on there. There is a larger framework document, just healthcare, that I recently posted to that site, and it gets into all subject matters of healthcare. And so that's available there too. But I would just like to, I'm just launching it, and I'm hoping to be able to make a little bit of an impact here locally in my community, and hopefully a little wider.
Say the name one more time.
Unraveling Twists, explaining outcomes that surprise us.
We'll be sure to include a link to that on our Words and Numbers Backstage Facebook group when the time comes. And if you're not on that group, well, what are you waiting for? Come on.
Oh no, I've been on that group for 6 years.
No, not
now.
you. I'm talking to those people out there who consistently say, well, how come I can't have the link? Well, here's why. You're not with us.
No,
but if you write to...
Very thankful for Words and Numbers and the work that you guys do sincerely. And so appreciate you guys very much.
Well, thank you for joining us and helping us cover a topic that we've shied away from for a long time.
We have avoided this for 8 years. So thank you.
Happy to be able to bring the depressing flavor to you, James, based on how it ended up.
And you know how badly you've screwed yourself over here, right? Because every single time something stupid happens in the healthcare market, you got to come back.
Right.
Hey, I actually, believe it or not, find the industry fascinating. And it's a lot like trying to unscramble eggs at times, but it is fascinating how we got into this mess and to try to think of ways to work out of it. And it's a Herculean mental experiment every time.
Well, thanks for everything, and I look forward to talking to you again
Thank you, guys.
soon enough. Soon enough.
At Words and Numbers, we spend a lot of time talking about what's going on in the economy and the government, but fundamentally all of this boils down to one thing. The greatest threat facing modern society is a lack of respect. The people who disagree somehow find it difficult, if not impossible, to discuss their differences in a civil manner. We at Civil are interested in upgrading civilization by encouraging people to engage with new ideas and ultimately engage civilly with each other. If you share this idea, please join us by subscribing at civil.com. That's CIVL.com.